Hey guys, and welcome back. For those of you new to the channel, my name is Dr. Glover. I'm a clinical gastroenterologist out in beautiful Las Vegas, Nevada. Perhaps the most common complaint I see in GI clinic, secondary to maybe constipation, is epigastric pain, reflux, heartburn. In this video, I'm going to share with you my tier list of the most common over-the-counter and prescribed antacids. Which ones work, which ones don't, and which ones are unsafe to take. So let's get right into it. I'm going to start first with Gaviscon. So Gaviscon is a combination of both magnesium carbonate and aluminum hydroxide. I love Gaviscon. The way it works is a little different than the other antacids. It's actually a barrier antacid. What does that mean? So imagine you have liquid in your stomach, right? Gaviscon sits on the top and coats the liquid so that when it refluxates up, it's simply non-acidic. It's highly effective, it's cheap, it's available over the counter at almost every country. The only complaint I've ever heard from Gaviscon is that because it does have some magnesium, it can give a little diarrhea. But overall, I'm a big fan of Gaviscon, and I'm going to go ahead and put it in the A tier. Next, we have maybe the most famous of all antacids, and that is TUMS. TUMS is straight calcium carbonate. There's only one ingredient. And although it's popular and well marketed, I am not a fan in the slightest for the following reasons. Number one, the calcium component in many of my patients causes severe constipation. More problematic is that over the last 4 to 6 months, I've had 2 patients come to the hospital with TUMS overdose. I never even knew such a thing existed, but it does. Look it up. It's called Milk-Alkali syndrome. Because they were taking so much TUMS, the calcium in their blood, the level was sky high. And what they don't tell you, it's not on any warnings here that I can find, quite inappropriate, is that the calcium can push you into renal failure. So any patients that have chronic kidney disease or kidney problems, in my opinion, should not take TUMS. Of those 2 patients that came to the hospital of TUMS overdose, one ended up on dialysis permanently, and the other had to have dialysis for a couple weeks. Eventually, their kidney function recovered, thank God. So TUMS works, but why would we use this medication when there's better and safer alternatives? So for that reason, I've seen too much. I'm going to go ahead and put TUMS in the D tier. Next, we have the close cousin of TUMS, and that is Mylanta. So Mylanta is very similar to TUMS in some ways, but also different. It also has calcium carbonate, but in addition has magnesium hydroxide and simethicone. Let's take those down one by one. Calcium carbonate is just an antacid. It helps to neutralize the acid, very similar to TUMS. The simethicone is actually the same active ingredient as you can find in Gas-X. It works as a surfactant. It breaks down the surface tension of bubbles and liquid in your GI tract. So if you're having heartburn and bloating at the same time, Mylanta is a reasonable choice. One of the biggest drawbacks I see with Mylanta is that because it does have magnesium, kind of like Gaviscon, it can give you some diarrhea. But although it also has calcium carbonate like TUMS, I've never seen similar overdoses or poor outcomes. So for all these reasons, I'm going to go ahead and put Mylanta in the C tier. Next, we have the granddaddy class of antacids, and these are the proton pump inhibitors. I'm talking about things like the purple pill, nexium, which is esomeprazole, and then we also got here Prilosec, which is omeprazole. So anything that ends in a ozol is a proton pump inhibitor, and these work by inhibiting the proton pumps in your stomach that produce the acid. There's many in this class: Prilosec, Prevacid, nexium. They're all about the same, and these are highly effective and one of the top 3 medications most commonly prescribed in the United States. The difference is that over the counter, you can only get 20 milligrams, which is sufficient in most patients, but not all. If you want 40 milligrams, that is prescription grade. One of the downsides of these proton pump inhibitors, they work great, but you have to take it every day, 30 minutes before the first solid meal of the day. You want to take it right before you eat, because when you eat is when the proton pump inhibitors, the proton pumps become active and are able to be inhibited. There's also significant controversy with the PPIs in terms of potential or purported long-term risks. We're talking about things like early death, dementia, Alzheimer's, kidney disease, osteoporosis, gastric cancers. But I will tell you that if you look at these studies that say these PPIs are purported to be associated, and I think that's the opportune word, with all these outcomes, you'll see that they are observational association studies. You can correlate anything with anything. It doesn't mean it's true, and correlation is not causation. Let me give you a silly example to exemplify the point. I'm in Las Vegas and summer's coming. It's starting to get hot. In the summer months in Las Vegas, ice cream consumption skyrockets. This makes sense, right? Maybe because of the heat, I don't know. People get mad. The murder rate also spikes significantly in the summer months. Statistically, there is an excellent correlation or association between ice cream consumption and murder. But we know that's silly, right? So my point is that I don't believe, nor do the studies suggest, that any of these purported risks are true. And if you really look at the data, the only proven real side effect of these proton pump inhibitors is a slightly increased risk of enteric infections, i.e. food poisoning. And that's because when you no longer have the acid to kill or protect you against any of the enteric organisms you may eat, you're more prone to infection. That risk is real, but it's still very, very low. So these PPIs are great. They're effective. They work. They're over the counter. The risks are minimal. And for those reasons, I'm going to go ahead and put this Nexium and all the other PPIs in the A tier. Next, we have the next generation of PPIs, and these are the PCABs. PCAB stands for Potassium Competitive Acid Blocker. Vonoprazan, aka Voquenza, and it's available in 2 doses, both 20 and 10 milligrams. The 10 milligram Voquenza is indicated in patients that have reflux, that is refractory or non-responsive to the PPI meds, and the 20 milligram is indicated for patients that have overt esophagitis or gastritis or a gastric ulcer that does not respond to PPI therapy. They work in a slightly different but faster and more effective mechanism compared to the PPIs. So these medications are very good. They work fast, but the only problem I have is because they're so new, it's often difficult to get the medication approved by insurance. And what good is a medication if I can't get it to my patients? So although these PCABs are highly effective, they work, I'm going to put them in the B tier just because they're a little new and sometimes difficult to obtain. I will say, as a side note, both these PPIs and PCABs have indications beyond just reflux disease. For example, both are used in conjunction with antibiotics to help treat the most common chronic infection of mankind, aka H. pylori. And if you're interested, you can check out the video I did about H. pylori. I'll leave a link here. They are also used to treat other disorders like eosinophilic esophagitis. Next up, we have perhaps my favorite, and that is Pepcid. So Pepcid is famotidine, and this is an H2 antihistamine. I think when people think about antihistamines, they usually think about allergy medications like Claritin, but those are H1 antihistamines. The H2 antihistamines block the histamines in your stomach that help to produce gastric acid. So these are things like Pepcid, Tagamet, and Zantac. I like these a lot because Unlike the PCABs or the PPIs, you can take these as needed. You don't have to take them every day for them to be maximally effective. They're over the counter, they're cheap. The only real drawback is that there is a component of tachyphylaxis, which is just a fancy word for saying if you take it for too long, it may stop working. Some of my patients who take Pepcid for a couple months to years come in and they say eventually it's not working anymore, we got to upgrade our antacids. It's also true there was a significant controversy in the past about Zantac, which is of this same class, about Zantac causing cancer. It was mixed with NDMA, which was an additive that was a carcinogen. So Zantac was taken off the market, but it had nothing to do with the antihistamine drug itself, nor were any of the other in the class affected. So for all these reasons, Pepcid's solid. Take it as needed, get it everywhere. It's cheap, it works. I'm gonna go ahead and put Pepcid in the S class. Rolaids next. Rolaids are pretty basic. Aluminum hydroxide, magnesium hydroxide, both of these are antacids. I've never heard anything bad about it, but no one raves about Rolaids either. Pretty simple, 2 antacid components. I'm gonna go ahead and put Rolaids in probably the C tier. No real drawbacks, but I've never heard any of my patients say it works really well. Last but not least, we have Alka-Seltzer. Alka-Seltzer, as the name suggests, is both alkaline and a seltzer. Alkaline, meaning basic, as opposed to an acid. It has a couple unique ingredients, and that is it has aspirin, sodium hydroxide, which is baking soda, and it also has citric acid. Now you may be asking, why is citric acid an ingredient in an antacid? And that's because the citric acid interacts with the sodium bicarbonate, the baking soda, to give the fizziness, the seltzer in the Alka-Seltzer. And the Alka is because it's a base and it neutralizes the acid. I don't know why they included aspirin in an antacid, because aspirin has nothing to do with reflux or heartburn. Maybe if you're having some joint pains or fever, it may help. But if anything, aspirin is a member of the non-steroidal anti-inflammatory drug class that can cause ulcers if taken in excess. So Alka-Seltzers, it's cheap, it's effective, it works, there's minimal drawbacks. So I'm gonna go ahead and put Alka-Seltzer in the B tier. That's all I had for you guys. Those are the most common over-the-counter and prescribed antacids that I know of. If I missed any, let me know below. If you disagree with my ranking, let me know below and let me know why. I love reading your comments. Anyways, that's all I had, and I will see you in the next one.